All right, so welcome. Those of you who have been with the Empowered Women's Circle know what we're all about. Otherwise, you'll hear little bits about it here. And otherwise, we're going to dive right into some information and some sharing and some challenges the world over. We are the Empowered Women's Circle. We strengthen our body, elevate our mind, nurture our soul. We are a wellness movement for women. And I have opened this up to this entire community because I feel like the information we're going to get through today and the grounding I am really desiring to impart to you will be of value to you. That is my hope. And as with every session, just because it's so important that we come into this space with our presence and our mindfulness, I'm going to do a very short opening centering today. So I'll get you to take a nice big deep breath. And if you're somewhere where it's safe to do so, you're not out on a walk or driving a car, go ahead and close your eyes. Take a nice big breath and just drop your awareness into your body. Oh, take some nice big breaths there just to release some tension. I know I've felt it from my day today. And just drop your awareness into your body. Feel the weight in your chair, wherever you're sitting. And into your legs, your feet, the soles of your feet, and into the earth. And as we come together into this space to learn, to absorb, to flex and flow with this information that's emerging and changing by the minute, I just invite you to use this time that we're together as a chance to be present with yourself, as an opportunity to give yourself permission to just be in this space. So to take in some of the facts and the figures that I will share, and to take in the humanity of it all, and to just allow yourself to maybe feel a little differently in this space than you do when you go about your day, checking the numbers or watching the news or staying off your devices or trying to get outside, whatever it is you're trying to do. Set it all aside and just drop into your own awareness of your own body, of your own needs, of the things that are coming up for you when you give yourself that space, that permission to really think about how this is impacting you and what you can do to ground deeper into your strengths, your gifts, your competencies, your confidence, and your power as a woman in the world. When people are relying on us and pulling us in a million different directions, we often forget that we have that deep, deep root system that allows us to tap into and to be our most powerful, our most confident, our most capable self. And I just ask you to drop into that space as we go through our time together. Take a couple big, deep cleansing breaths. And wiggle fingers, wiggle toes. Come on back into our space together.
Okay, baby, whatever.
And I'm just trying to find my. I'm gonna see if I make Migdalia a co-host. Maybe you can help me with some of the volume muting. And when you guys heard that during my meditation, you might have heard the door open. That was my dog. He comes in every single time I meditate. Especially when I'm doing it in a group like this, I think he feels the energy, like no matter where he is in the house, and he comes and he lays right beside me. It's the most profound thing. So I'm just going to close the door that he opened on his own. It's just so interesting to me. So here we go. We operate inside these shared commitments, which I'm not going to go through in great detail, but we'll refer back to them if we have to tonight. Essentially, we are here to be in our strength and in our self-responsibility. There's a lot that could come up tonight in this conversation, and I just ask us to be generative, solution-oriented, respectful dialogue, really be here for yourself and your needs, but really taking self-responsibility for what that is. So we're not here to provide advice. We're not here to tell each other what to do. We're here to really tap into our own process, our own needs, and ultimately gain for our own growth in our time here together. And we do that from a very strong place of power, and also by reaching out, mirroring, and amplifying the other women who are here doing the same thing for themselves. We are ultimately, this sums it up, an inclusive group extending acceptance, love, and support to anyone who shows up in their power here with us. So, getting right to the talk, right to the presentation, only the facts, please. And we're going to talk about some ways to protect yourself, coming back at the end to body, mind, and soul pieces, and then offering some ongoing resources. We are ultimately in the Empowered Women Circle. We have an exclusive membership group that meets at this time on Monday evenings for group coaching around our own wellness processes. And I opened up this session so that we could really offer all of this to a larger community, to everyone who heard about it and wanted to attend. Not because I want to be giving more and more and more COVID-19 information, but because I think there's a lot out there. There's a lot of gray, there's a lot of muddied waters. And I feel, especially for our Empowered Women Circle and for our bigger community, it behooves me to take all that's coming at us at a really rapid pace and to collate it and consolidate it, and to give you an opportunity to maybe ask some questions around those things. I want to be clear. So then this is what we're going to go through: the chronology of COVID-19, not in great detail, but what I'd really like to provide you is a couple of resources so that if you're looking for accurate information, you know where to get it. Because even the WHO, which is probably the most credible source, has actually kind of fallen off in some of their data tracking. And of course, we all know why. They have other fish to fry. They have a lot going on. I want to cover what we know to be true, and it may be a lot less than what you're hearing in terms of actually knowing. Expectations for US spread, and I think that's valuable for us because that answers some of the questions we were talking about at the top, which is, what do we do? Do we start to slowly go out back to work? Do we continue to, even in these economic times, do we continue to sacrifice for the sake of a greater good? I mean, I think these are not in the category of yes, we know, but they're in the category of let's make some informed decisions. I want to cover what to do, what not to do, what's isolation versus what's quarantine, and when to return to work. And there'll be some other questions, I think, toward the end that little snippets of facts have come in over time, and I can answer some of those more detailed questions as you desire to ask them. And then the future, and how do we lead? And I think you heard in the meditation that is really something that is near and dear to me, is the fact that women are the rocks. We are the center of a lot of these circles in our families, in our communities, in our workplaces, and so vital that we are able to look after ourselves enough to be able to ground in and extend. Ground in and extend. I want to make sure that you don't think I'm giving you medical advice. If you have specific medical questions, make sure you reach out and let me know, that's a medical question, I need a medical answer, and I'll guide you. But that's not what we're here to do, and I want to make sure that everyone understands that. And keeping in mind, I am an OBGYN. I have not properly introduced myself to some people who may not yet know me. So I'm a board certified obstetrician gynecologist and been practicing for over 20 years. Oh, I hate to say that because it's so long now. My subspecialty is menopause and the ambulatory gynecology side of things, as well as relationship and sexual function. And through my medical training, I have been able to take that lens and look at a lot of this information, but I am not an ID expert, but definitely have some resources from ID for sure. Yeah, and Migdalia is really helping me. I thought she was telling me to introduce myself and say where I live because I just realized I hadn't done that yet. But she's asking you guys in the chat to go ahead and introduce yourself and say where you live. Some of you we know and some of you we don't, but you don't all know each other. So that's a really, really great idea. Thank you. Thanks for doing that. That'll be really great for us to keep and see that later on where you're coming from. I was trained in Canada, kind of just outside Toronto area, and I've been living and working in Houston, Texas for the last 10 years. So accurate as of today, and you guys can see that everything is shifting and changing. So I'm going to go real high level and try not to get down into the mud on all of this, but what is accurate as of today? Fear and panic are not going to help us. And so if you're starting to feel anxiety and you're starting to feel like heart palpitations around some of what we're talking about, just stop me, put your hand up, put in the chat, let's take a moment, because there is no better place for us to really drop into safety, drop into comfort, drop into dialogue, drop into a supportive community. The goal here is not to be like the news firing stuff at you, but I do want to go high level and really talk about what's going on in the world. And to keep in mind, we want to be informed and prepared, because that ultimately is going to help everyone, and it's ultimately going to help us get back to normalcy a whole lot faster. Yeah, I love this, seeing where everybody's coming from. So historical highlights. First, what was really interesting in doing this research was going back through the Wuhan health reports. They were in Chinese, obviously, but you could have them translated, and it was very interesting. So they think the first possible case may have been December 8th. And I want to say this, and I'll say this many, many times over the next several weeks to months. The retrospectoscope is very, very accurate. So we always find with anything, whether it's economics, whether, business, medicine, doesn't matter what it is. If we look retrospectively, we think, oh, we could have predicted that, or we knew what that was. And so I want to really be clear that as we interpret, as not just us, but public health officials interpret the information, they're gathering more information, which is allowing them to go back and reinterpret previous information. And so they get more accurate as they go, but that doesn't mean that they necessarily could have known at the time. So January 11th, the Wuhan health report to the WHO, there was unknown causes of viral pneumonia. And from December 8th to January 11th, there was pneumonia. And you can imagine pneumonia in a hospital, and that just happens. And I think probably looking back, they realized, okay, this is a pneumonia. Maybe we should be swabbing it. We should be figuring out what it was. And that's exactly what they did. Then they determined, as soon as they knew that it was a novel, and I'm going to sort of explain what that is, but a novel coronavirus, they started basically 5 elements, and that's what they started their kind of like their 5-point attack. It was to diagnose, treat, and they went into immediate isolation, and they recruited their experts. They started an investigation, and I know there's a lot of rumor around how this all started. I don't know that they will ever know, but they found all the cases those initial cases were operating and purchasing staff of the South China seafood wholesale market. I have read about various animals and various contacts and all of those things, but this is what is in the report. And they determined that they were going to publicize this widely, and they were going to cooperate with all levels of government and WHO. I think what I am hearing a lot of people talk about, and I find the most shock and awe and probably the most interesting, is the connectedness of it all. The fact that this started with, well, likely one if not a couple of cases. And if you look at any graphics, and I didn't pull, I looked at a bunch, but I really didn't want to bring them in. They look like a video game. But if you look at any graphics, they just verify for us as a global citizenship that we are all connected. And what is really interesting to me is that we are not just connected by the oxygen we breathe. We are very literally connected by our bodily fluids. And I don't know that we have ever really considered that. Well, I had never considered that we are that connected, that this is a droplet spread. This is not aerosolized. You are not getting this from the air. This is droplet spread. And for it to be droplet spread, it has to go from someone's droplets to your mucous membranes, and the connectedness of all of this becoming a global pandemic from a few cases in China. Just incredible. To compare, because we see so much seasonal flu, the deaths for flu are up to 650,000 annually, up to 1,800 a day during the seasons of flu. SARS, which was very short-lived, had a fatality rate of almost 10%, so 774 deaths from 8,000 infections. COVID-19 surpassed not the fatality rate, I'll show you that in a minute, it surpassed the number of infections worldwide on January 29th. And MERS, which is Middle Eastern Respiratory Syndrome, was a very short-lived 2012, but took 900 people and had a fatality rate of 34.4. And Migdalia, I can see you, so if something in the chat is for me to respond to, let me know. I think it's important that that we kind of understand, because this is going to become more and more discussed. Transmission rate, or R naught, is number of new infections. COVID is estimated to have a transmission rate for every one person infecting up to 3.5 people. And these are new numbers. This is a virus that was not on the planet Earth until December, so it's only a few months. These numbers are changing and emerging, but as of today, flu transmission rate was 1.3, SARS was 2.0 as comparisons. Case fatality rate, approximately 3%. SARS was 10, MERS was 34. And asymptomatic transmission, which significantly and exponentially elevates the risk. So you've got people walking around, they don't have any symptoms whatsoever, and they've got about up to 14, but more likely 10 days when they're going to be transmitting it. So that's the really, really scary part for us. And that's the part that Jennifer and I were talking about, and also my sister-in-law and I were talking about at great length. You know, it's going to be very difficult to stop the transmission when we've got people who are asymptomatic, have no idea they have it, and they're transmitting. And projections are just projections, but this was one projection at a conference in February, and this is, again, not meant to scare anybody. It is really meant to show us that we are in this for the long run. This projection, although is entirely number crunching, it is entirely model-based. The prediction was 94 million cases in the US with 4.8 million hospitalizations and almost 500,000 deaths. I think that the main point here, because we can only control what we can control, is the need to stay home and the need to do, and we'll talk about self-isolation versus quarantine in a minute, but the need to really take this seriously. And I've been reading some social psychology sort of information lately, and our human tendency is, when we hear about one person and some real heartfelt stories about one person, and that's what I've been trying to post on my MD page, is the one person, the Italian doctor that we lost, or that young man in Ontario whose wife has come forward to talk about how important it is for us to take this seriously. When we talk about one person, our human tendency is to really feel that. But when we start talking about millions, we get a little bit, we are able, as humanity is wired, we're able to step back and look at that as more of a number than actual people. That's human nature. And daily updates, and I'm not sure where you're getting your daily updates. The WHO was very good until very recently, but the daily updates coming out of this website, and I'm going to show you what those look like in a minute. Projections are very high. We're not near the end. We're not near the peak. And what is most concerning, specifically in the US, is the drain on healthcare. So when we see the deaths, as devastating as that is, it's the tip of the iceberg for the people who would otherwise be saved by having had adequate healthcare, who are not able to get adequate healthcare because of the sheer numbers of what is coming. We're not here yet, but it is possible that we get here, and again, to take this very seriously. And if each of you influence, I don't know, we say numbers tell us that we each influence 1,000 people, and that if we're actually working in bigger circles, we influence more like a couple thousand people. But let's say you influence 100 people, you're going to have a significant impact if you share some of the gravity of this situation. And I do want to show you that web page. So I'm going to stop share for a minute, and then I'm going to reshare the web page and a couple of web pages that I think are relevant. So this is the one that I'm using to get the data. This is worldwide cases, worldwide deaths, worldwide recoveries. And currently, if you look at closed cases, I don't know if you can see my cursor moving or not, but if you look at closed cases, current death rate on closed cases is about 14%. So remember, SARS was, what did we say? SARS was about 2, I think, and MERS was like 34. No, SARS was like 9 and MERS was like 34. That was it. And this is falling somewhere around 14. If you actually look at some of the numbers in some of the countries, I'm going to talk about Germany shortly, really, really low. And you look at other countries like the US is actually considerably higher. And we can banter about some of those reasons. But the other thing about this is that you can actually look at different countries. And if you continue to scroll down, it's going to show you your specific area of interest. It's going to show you total cases, it's going to show you new cases, it's going to show you total deaths and new deaths. And of course, it's the new cases and tragically the new deaths that are the daily concern. This is today, and you can click, and that was yesterday. So you can see for China, their new cases are falling considerably. So that is really good information. And I should probably scroll down enough for you guys to see Canada. So here's Canada. A couple other things while we're over here on the web. CDC is absolutely the best place for you to go for information. The CDC is really busy providing this kind of information: how it spreads, symptoms, prevention and treatment, stigma and resilience. It's interesting, the stigma piece. I think that's going to become more prevalent. I mean, so many people, like Jennifer was saying, we're kind of going to get this. I mean, my husband and I have talked about this too. There's 2 tickets out of this, right? You get it, or you get a vaccination or some form of preventative treatment. That's kind of I mean, that's what I'm seeing now. It doesn't mean that's the only, I mean, maybe something else will come up, or maybe everyone will stay home and transmission will stop. That would be ideal, and the virus will ultimately eradicate itself by expiring, and that is possible. But from what we've seen in New York City and some of these other places, I'm not sure everyone's doing that, but that is what I would encourage everyone to do. what to do if you're sick, frequently asked questions. So this is CDC, really valuable information. I love this. The World Health Organization, also really valuable information. They have this site called Staying Physically Active During Self-Quarantine, and it gives you all kinds of fun things you can do. I love that site. And I'm looking for ways, I've been sharing a little bit, but I'm looking for online free workouts because I think we all need more and more of those. I wanted to keep this open because I wanted to share, you need to be careful. The WHO is saying that people are now reaching out to people and asking for their contact information. WHO is not going to call you and ask you for anything. This is my webpage, and this is Friendswood, Texas. So I'm trying to think of who we have local. I think Kim is local. We have a few more local people. I wanted to know what you would do if you got symptoms and you wanted to report, and this is exactly where you would go. So right, this yellow banner along the top is where you would click, and it directs you, if you're local, to Friendswood. So let's go back to the slides here. There we go. So some of those resources, if you hadn't seen them already, are becoming more valuable. On the Worldometers, it kind of sounds kind of hokey. My brother was laughing at me for watching that, but if you actually look at the numbers and you go to the sources are the WHO and the CDC and all very, very reputable places. But I think the Worldometers is it just has the human resources enough to track the data. Somebody have something to say about Worldometers? So what can we do? If another person tells you to wash your hands for 20 seconds, you're probably going to hang them, right? Wash your hands. I can tell you, honestly, I'm a doctor and I've washed my hands very copiously my whole life. I'm washing my hands now more than ever before. 60% hand sanitizer, there's a typo there, 60% alcohol hand sanitizer, disinfect, disinfect, disinfect. We've heard that already today. Sneezing into a tissue and discarding it, of course, it's gonna get on your hands if you do that, so you have to wash your hands. But no more sneezing in your elbow. I guess your elbow is better than nowhere, but it lives on clothes for up to a week. So it's gonna live on your clothes, and if people are sneezing in their elbows and not laundering their clothes, we're gonna have clothes contamination. 6 foot or 2 meters of distance so that you're not having droplet spread. It is damaged or eradicated by heat. So if you're, a couple of things that aren't on the slide, just to share, it's gonna live on plastic and stainless steel for about 3 days. Uh-oh. Getting an echo here. And it's going to live on cardboard for up to 24 hours. And paper and those kinds of things, again, could be up to 24 hours. And heat. So what we get delivered to our house is pizza on Friday nights. And I'm thinking, do we still do that or don't do that? But if it's heated or you cook your food, it's going to eradicate the virus. In other words, I would not be eating sushi, and I hate to say that because I love the sushi lady at my store, but I would not be eating raw food in this time frame. We are literally quarantining our mail. It's going into another room and it's sitting there for more than 24 hours or more than a couple of days, depending on what it is. We're quarantining our groceries. They're sitting also somewhere. We're wiping them down before we're handling them, and we're washing after we handle anything like that. Clothes to be washed in hot water.
Hey, Catherine, so Kim has a question. She wants to know if peroxide will work if there's no alcohol or hand sanitizer available.
I don't know the answer to that. I don't know the answer to that. I know vinegar does not, and I know lemon probably does not, but I haven't read anywhere about peroxide. I'm gonna hazard a guess. If you cannot get alcohol, peroxide is probably pretty good. The other thing that might be available is chlorhexidine. You can buy surgical scrub at betadine. I know my accent's probably giving you a hassle. Betadine is Betadine, and chlorhexidine is chlorhexidine, chlorhexidine, which are surgical scrubs, which are both going to eradicate anything because we use them in surgery. Peroxide we don't use for disinfectants in the hospital, so I would stick with one of those other alcohol. Bleach, you can probably get your hands on some bleach, and you want to do a proportion of bleach, and I can't remember what it is. If somebody remembers what it is, put it in the chat. I think it might be 10%, but I'm not sure. And the other thing you want to make sure it has been tested is zinc. In many ways will disrupt the virus. So zinc throat lozenges, and if you what we're doing in our home, if we're out and about, is we're using zinc throat lozenges, and you can actually lay down and you can let them coat the back of your mouth and coat the back of your throat. We think this virus, I don't mean we, I mean they, think this virus lives in the mucous membranes of the throat for a couple of days before it goes to the lungs. So zinc has been tested on coronaviruses in general, and it does work to damage the virus. Latex or some kind of disposable gloves. Surgical masks are not to prevent you from getting anything, because you're not getting this from the air, but they are to prevent you from touching your face. So if you really feel like you can't stop touching your face, we apparently touch our face more than 90 times a day and don't know we're doing it, then that's when you would need a surgical mask. What not to do, not to panic, not to hoard. Don't take stuff that others may depend on for their survival. And we're going to circle back to that when we talk about treatments. If we all stock up on face masks, there's not going to be enough. Looking at those numbers that we just projected for what's coming down the healthcare system, there's not going to be enough. The companies aren't going to be able to pump them out for everybody. So we have not stocked up on masks in our house. I can't think of a reason we would need one, except maybe if someone in our family got infected and we needed to go in and bring them food and water and things, we would probably use something else over our face. But we have stocked up on zinc lozenges. I have them right beside me. We've stocked up on hand sanitizer. And I say stock up, I mean we've got a couple of bottles, just a couple of bottles. I'm not talking about like trucks full. And gloves, because we were traveling across the country. We wanted gloves for gas stations and things like that. And keeping in mind what's important. And I put the case of Germany because Jeremy and I have these really interesting dialogues nightly when we look at the numbers, and Germany is keeping things very, very stable. And so we were talking about culturally what's going on there that is not going on here. And obviously, if you imagine the culture, it's possible that they're taking this to the point where they are taking it a lot more seriously and taking their government regulations a lot more seriously and not going out. And they're keeping their numbers at bay, which is pretty remarkable. And in terms of supplies, I mean, we have kind of just go to the store and buy whatever you want. And literally, Jeremy was walking through Home Depot a couple nights ago because we had a leak on a hot water heater of all things, and walking through Home Depot looking for one package of toilet paper. There was none on the shelves, and I said, you know what, with all this toilet paper thing, you better get a package of toilet paper. And there was a man with 3 in his cart, and Jeremy said, hey, by the way, where'd you get those? And the man said to him, well, I took the last 3, but you can have one. And I thought, you know what, that tiny little example of someone having a heart was inspiring for us. So I mean it when I say, like, let's not be hoarding stuff. You know, there is no reason. I believe the experts when they say there is no reason to believe that the food chains will be shut down. I believe the food chains will continue and food will be available to us. Toilet paper is an optional item, but it, should continue to be available to us. And I think in all of this, I'll go back to one of the other points I made. We are all connected in such an intense and obvious way that if nothing else, we should realize that everything we do impacts so many people on a much bigger scale than I think we ever realized until we experienced this. What you do not need, you do not need to stock up on antibiotics. You should not be, antibiotics are for bacteria. This is a virus. It's a novel virus your body has never seen before. There is nothing that can, there's no familiarity of this to your body. So there's no treatment at this point except supportive measures. More than 80%, probably closer to 95% of people will do just fine with this virus, kind of like a flu. The scary part is we just don't know. And just like we said at the beginning, it's the unpredictability and it's the uncertainty. And so it's really not worth, we're not going to go out and have chickenpox parties like we used to. I mean, if you guys remember those days, we used to take our kids to chickenpox parties so that they would get chickenpox. I was telling my kids that at dinner the other day, and they laughed at me. They're like, what? Well, now they just get a vaccination and they never see chickenpox. But they said, well, what happens when you get chickenpox? Remember, we got those spots all over us and we picked them and we got scars and secondary infections and all those things. But we had to have chickenpox in order to be immune to it. It's unlikely we're going to have COVID-19 parties anytime soon, but it's very likely that they will develop a vaccination, provide us with antibodies, and it will be something that we need to continue. And I'm going to circle back a little bit more to future in a minute. You do not need Tamiflu. It hasn't been shown to work. You don't need ventilator nebulizers unless you have asthma or lung disease in some capacity. You will not be staying home to treat yourself if you start having trouble breathing with this. It's a novel strain. Drug testing's not been done. I'm going to really strong. I've had very, very, very intelligent people asking me what they should be getting prescriptions for so that they can stock at home some antibiotics or Tamiflu or Ventolin. Or, I mean, they're asking me, you guys can ask me on the chat if there's something you're wondering about. But I very truly, and I say this, I do the same thing for my family, I would not mess with your immune system. I would really allow your immune system to do what it is built and trained to do and augment it in as many natural ways as you can with diet and exercise, meditation, good sleep hygiene, good social time. I mean, all of these things that the Empowered Women's Circle talks about with body, mind, and soul is the best medicine for your immune system. And I'm sure that you're going to have questions on that. So I'll wait for you to ask me some things on that. Under consideration for treatment, you guys aren't going to stock up on these things, but I want you to be aware they're under consideration. A couple of HIV drugs, antiretrovirals, a couple of drugs that are used for malaria and rheumatoid arthritis, and a drug that has previously shown some effect with SARS and Ebola virus. Now, just tonight before I came live with you, there was an article that came out about shortages of hydrochloroquine. Hydrochloroquine is a life-saving and life-altering treatment for people with autoimmune disease, specifically people with lupus and rheumatoid arthritis. And because there's been some public announcement that hydroxychloroquine, or also called chloroquine, with azithromycin, which is an antibiotic, has been somewhat effective against COVID-19, everybody's going out to get it. And in fact, the president of the US tweeted that combination is, I should get the words that he used, is like world-changing treatment. And in fact, it has not been tested. It is not proven to be curative. There is no good evidence that anybody should be using hydroxychloroquine except in studies and trials. And if you're that sick, you really need to be in the hospital where the doctors can be managing your ventilation needs. So I'm sure all of you are aware, but this essentially goes to throat and to lungs. It's a virus that attaches to lung tissue. And the symptoms are going to be cold-like, upper respiratory, and then lung, productive cough, mucus production, and then ultimately, potentially, in some people, some trouble breathing. And before any of that happens, you need to be in the hospital. There's been some situations where people are taking prescriptions, or even doctors are writing prescriptions for hydrochloroquine for asymptomatic people to keep at home. That is not okay. That is not what this world is about. That is not what we're here to do. We want these medicines to be available to the people who need them. We want protective equipment to be available to the people who need it. So I'm sharing this with you, but nothing's been tested. So remember that hoarding can kill others. So just taking things because you think they may protect you is not going to help globally. So if you have if you need non-medical care and it's not a respiratory or a potential COVID contact, maybe you could try for a little while to stay out of the healthcare system. So I say try to manage or self-treat any non-life-threatening, any conditions that do not seem like they're COVID and that you could potentially manage at home. And I know in the US, people generally stay away from healthcare because of the cost associated until they need it, till they really need it. And sometimes I think that's showing up as presenting too late in some cases, which is maybe why the US deaths are high. Whereas in Canada, people will often go for healthcare maybe before they need it. And so they're very different systems, and we're going to see very different transmission in those two countries. Using telemedicine, and I did put my website here because there's a way for you to connect with me. I haven't put medical visits up on my webpage yet, but that will be coming, and so you can watch for that. But there's a way you can connect if you have specific medical questions. You guys all know how to reach me. We can decide on how best for you to get the treatment or the care that you need. I would highly recommend canceling elective surgery. And I will go so far as to say that if your surgery has not already been canceled, you need to be very seriously considering how badly you want it or need it, because the hospital is the last place you want to be right now. And remember that every time you access a service, it's one less service that a patient with COVID-19 could potentially have. And then all those disposable items that they're using for your care are not going to be available when people need it. And you've all seen, I'm sure, some of the stories out of Italy where, just the system is just burst to the point of breaking.
Hey, Catherine.
Mm-hmm.
Can you go? Can you repeat the symptoms of COVID? Because Elizabeth Morris had a question about if fever was a symptom of COVID.
Yes, so fever is a symptom of COVID. Yes, the symptoms of COVID, and it's a really good question. So let's be really clear, because that is one of those pieces of information that you guys should be well aware of, and then always aware of where to find that information. So Elizabeth, if you look here at cdc.gov and you just basically remember cdc.gov, you're going to see places where you can click to see COVID, and then you can go to symptoms. So CDC is a wealth of credible information. Here's the symptoms. So fever, cough, and shortness of breath, essentially. And symptoms appear 2 to 14 days after exposure. And ultimately, you want to go to the hospital if you have any trouble breathing, persistent pain or pressure in your chest, new confusion or inability to rouse, meaning that you're hypoxic, you're not getting oxygen to your brain, bluish around your lips or face, and then more there. Yeah. And just put in the chat if that didn't answer your question, or if you have more there. Right. Great. So there's some big differences between self-isolation and isolation. So self-isolation meaning that you're monitoring yourself and you don't have symptoms, you may have possible exposure, but you're not really sure and you don't think so, you should stay home a minimum of 14 days. This is what we did with my husband and my son after they traveled from Canada, 14 days of self-isolation. Now, we isolated with them, so it's very possible we could have got it, but all of us didn't contact another person for 14 days from their international travel to ensure, not so much for us, but to ensure that we didn't asymptomatically spread to someone else. Report symptoms immediately, avoid contact with people. So isolation or quarantine is when you have symptoms or you have a diagnosis. You have to be in isolation, no other people around you. You need people to bring you breakfast in bed in this situation, and they need to wear protective gear. If you're awaiting results, stay home, avoid contact with anybody else, and then of course, if your symptoms are getting worse, you need to be reporting that. All right, I'm going to go into greater detail about how we can optimize our own immune system. Now, is there anything you can do to prevent yourself from getting COVID-19? No. There is no supplement, there is no vitamin, there is no essential oil, there is nothing that is going to prevent you from getting COVID-19 infection. We know that zinc may damage the virus enough once it's in your upper respiratory system to not continue to go to your lungs. It may kind of cut it short, but there is not a way to stop yourself from getting the virus if you're exposed to it. Now, some people get it and don't know they had it. So completely asymptomatic, no signs or anything. So that does happen. I don't know the percentages on that, but it's reasonably high, actually, like reasonably high. I'm going to throw a number out there, just an educated guess, probably maybe in the 10 to 15 to 20% kind of range may get it and never know they have it. And that number may change as we learn more. But I'm going to go into greater detail on this immune system piece on Thursday, and you're going to get an invite. If you go to Catherine Hansen MD Facebook page, then there's an event there called Truly Organic Spa, and I'm going to do the education session in conjunction with Jenna at the Truly Organic Spa, because she's asked for this specific information about immune system. But I don't want to keep you hanging. I want you to have the information right now. And so in a nutshell, there is really good science to show that your supplements should have vitamin C, vitamin D3, and that's a good quality D3, zinc, and potentially N-acetylcysteine. Now, if you guys know that I trust ID Life. If you're doing ID Life nutrition, those are already in there. If you're not, ID Life has an immune pack that has those things in them as part of their immune support. If you're doing a customized program, they're in there. If you're not sure, look at whatever it is you're taking and make sure at this stage and this time you're getting vitamin C, vitamin D3, zinc, and potentially N-acetylcysteine. And I know you're going to have questions on that too, so I'll circle back. I'm watching the literature currently. That's what the literature is telling us. And I'll present more of that on Thursday.
So Amy has a question. She says, do you take zinc all the time as a supplement or just upon symptoms?
The zinc lozenges, so I'll answer both. The zinc lozenges currently are recommended by some virologist experts and people that I've been reading from. And if my family has been out doing grocery shopping, or my daughter and I went for a run recently, we are doing this when we come back in the house. Just one lozenge, probably should do it a couple of days in a row, and I'm not even sure how many hours apart. It says do not exceed 7 tablets in 24 hours. So I mean, we should probably do one every couple of hours for like 2 or 3 doses. We've only done one because the contact risk was really low. Then this would only be in times like this when you're concerned about it contacting your mucous membranes because you're walking through the park and everybody's walking through the park at the same time, or you're grocery shopping, etc. As for zinc, zinc is in my everyday vitamin and supplement regime. I hope that answers that. So other questions, and I don't want to get into great detail on these because I'm not sure whether they're valuable for you, and I only want to be valuable for you. But I found these kind of things really, really interesting. And so I've kind of put them out there to see if they're of any interest to you. When can you return to work after isolation? Bottom line is you wait for public health officials. So isolation is essentially what we're all doing, or hopefully what we're all doing now, is we're self-isolating, we're avoiding contact, we're only going out for emergencies or groceries. I mean, I hope that's what everyone's doing. I really do. Worldwide, because that is the only third route out of this. One is to get it and ultimately build antibodies. Two is to have a vaccination, which is not going to be ready anytime soon. And yes, they're working on it. They've had a little success, but they're not there yet. I read that they're doing some human studies in China with a potential vaccine. They've only just got approval to start with a few people. And I'd love to see the ethics application on that. But that is months, if not year or so away. And then the third way out of this is if we all stay home and nobody spreads it to anybody, then there's potential that this will slowly start to go away. So that's when you can return to work after isolation. I know economics is a huge factor, and that also is, I think, the reason that the US numbers are spreading so rapidly is because of the lack of support for people who need to be at work. So in a social structure like Canada, in a lot of cases, unemployment insurance is kicking in quickly. There's some government relief. I'm not going to talk about the good and the bad and whether it's fast enough or too slow kind of thing right now, that political side of it. But in an infrastructure like Canada, there's a lot more economic stability versus in the US, if you don't work, you don't get your health care. And if you don't get your health care and you get sick, then the numbers that we see in the tracking are just going to be higher. And that is, in fact, what we're seeing. Another question, when can I return to work after an infection? This has yet to be ironed out. But ultimately, what they have done previously is if a patient has had infection, they need 2 negative tests at least 24 hours apart and complete resolution of symptoms. And they're talking about making at least a 14-day minimum before returning after those negative tests. That really needs to be ironed out, and the CDC will be providing that information to your healthcare provider as we go. I don't think we're there yet where that's become an acute question. Can I get reinfected after having COVID-19? I was shocked to read that yes, you actually potentially can. Viral loads can get an antibody response. It's kind of like needing a booster of some of our vaccinations. Your antibodies go up, fight off the virus, you're cured, and then the antibodies can slowly go down and you could potentially get reinfected with the virus again. They have yet to determine, again, this has only been on the planet for a few months. They have yet to determine the exact pathophysiology of that, but it is happening already. So the one wave we've had, potentially there could be another wave. Let's hope not. Let's hope not. And pregnancy is a whole other question. There are lots of clinical guidelines being out about pregnancy right now. If pregnancy is a really vital question, I would love to cover that in greater detail. But ultimately, we don't think there's vertical transmission, so we don't think moms are passing it on to babies. And we have SARS and MERS to kind of use. Those are both also coronaviruses. Coronavirus is one of the #1 causes of colds in the world. So coronaviruses can be very, very mild, and we're used to having them. But SARS was a novel coronavirus, MERS was a novel coronavirus, and now COVID-19 is a novel coronavirus. So when I'm saying coronavirus, we need to call it COVID-19. This is the difficult one. And we don't think it's passed to babies through moms, we don't think it causes any birth defects based on our information with pregnancies so far that we've seen with COVID-19, also with SARS and MERS. But we do think it could cause preterm labor. We do think it could cause intrauterine growth restriction, and it has caused already that we've tracked miscarriage. So more about pregnancy, I can go through those guidelines later.
Hey, Catherine.
Yeah.
Sorry, I keep interrupting you just before we move on. We have a very engaged chat going on, and I'm appreciating all these questions, but I definitely cannot answer them.
Yeah, let's do it. It's a good time.
Yeah, I've got 3 here. Laura would like to know, why does a mask not protect you? If you have a mask, wouldn't it protect your mucous membranes from contact with droplets? And I know you explained it earlier, but if you could go through that again, that'd be great.
Yeah, so it will protect you while it's on, but when you're actually not getting this by breathing, you're getting it by bringing it from your hand or clothing or any utensils and touching your face. So when you go to eat, when you go to change your clothes, when you go to take your mask off, the masks are intended to prevent infection from aerosolized pathogens, and this is not an aerosolized pathogen. So it will protect you if it stops you from bringing droplets to your face, but ultimately you've got to take that mask off, and it's probably all of the stuff is now on the outside of it, and all the other potential contaminants are still present for you. There are situations where COVID-19 is aerosolized for healthcare workers. I don't know if we have any healthcare workers. Maybe you can put in the chat. Maybe you can let me know if there's any nurses, doctors, physical therapists, people dealing with patients every day. But you can aerosolize COVID-19 when you're intubating a patient or putting them under general anesthetic. So if you're in a room when that's being done, then of course you need an N95 mask on, because then the virus is aerosolized and it can be breathed in. Otherwise, masks are really only intended for that purpose.
Okay, I hope that answers your question, Laura. Elizabeth would like to know if you can recommend a good zinc source from Amazon. I'm not too sure if the little bottle you had earlier was from Amazon or where you got that from.
Yeah, so this is a zinc lozenges. This is the one that happened to be left on the shelf at Walgreens or CVS. Zicam,
I think it's pronounced.
Yeah. But I don't have any. I would just see what they have available. I think they're probably going to be few and far between to find, and I'll tell you the dose on this, and that might be also something to look for. Yeah, it doesn't really. It says homeopathic, so it must be really, really low dose. If you could type this, it's the active ingredient is zincum. So Z. It's hard when I'm Canadian. I want to say Z. ZINCUM. And the second word is ACETICUM. And then the other active ingredient is the same first word, zincum, and the last word is gluconicum. So GLUCONICUM.
Don't worry, I'm putting it in the chat, y'all.
Okay, thank you. As far as zinc supplementation to take as a vitamin or mineral supplement, I can honestly tell you, quality-wise, I can't recommend anything on Amazon. And whoever that is, if you want to drop your email, whoever was asking that question, if you want to drop your email, I can send you more information. And also, I'll talk more about recommendations. That gives me a really good point I want to cover on Thursday is quality of supplements, because I think people, this is my pet peeve in life. If you know me, you know this. is people preying on other people at times of vulnerability. And vitamins and minerals are not going to prevent this. And quality supplements are hard to come by. We know that from good DNA studies on supplements that are over the counter in terms of what's actually in them versus fillers and inactive ingredients. Whether they have any of the active ingredient or not is questionable. So I'll go through that more on Thursday, and we'll make sure that a recording is available.
Okay, great. Last question from Lori. I'm going to butcher your last name. I'm sorry, Lori. Lori Mercereau. I'm not too sure. She would like to know what product you use that includes the 4 ingredients you mentioned earlier for immunity, that had the zinc and the vitamin C.
Yeah, for sure. Lori, again, can you put your email in there? So what I would like to do is I'm going to because I think we have a reasonable number of people, many of whom we know and others we don't. If you want me to send you follow-on information about the specific vitamins and supplements that I recommend, and I can also kind of put together a little bit more of that immunity information that I'll be presenting on Thursday and make that available to you, then go ahead and put your email in the chat. Migdalia will cut and paste those, and we'll make sure that we track that. I threw this together, Migdalia and I threw this together so quickly, we didn't think of a way to be able to communicate back and forth with you. We just wanted to get the information to you tonight. So we may be missing that piece. So if you drop your email in the chat, if you're not already on our list, because if you're already on our list, I'll be communicating this in follow-up. But if you're not already on our list, make sure you do that, and then I can send that to you. The immune support that I highly recommend, because I don't want to leave anybody like hanging here, but I do want to be able to provide you with more like complete information. It's hard to throw at you. Is an ID Life company that I have been researching, love and trust, and collaborate with for the last, since 2013, so a long, long time. And their SciMed panel, their manufacturing process, their raw ingredients. They're not a supplement company per se. They don't make supplements, but they bring raw ingredients in from the highest quality places. And I do a personalized regime for me. In other words, I do a HIPAA protected health assessment. It determines what I should be taking. It includes my zinc, and I know it includes vitamin D, vitamin C, and N-acetylcysteine. But if you don't want to go to that level of customization, they have an immune support, which includes the studied C, D, and zinc, and N-acetylcysteine. And I will make sure that you have a copy of this with all the nutrients listed in follow-up. Everybody that we have ability to communicate with in follow-up. Were there any other questions about that? Because I don't want to leave you with half the information. If you feel like you want more right now, ask me. This isn't meant to keep you in suspense for anything at all. Just also not meant to keep us here too late, because I know you all have families to get to. So we're almost finished. So don't hesitate to put more questions in the chat, because we're almost finished. Big breath. So we are in the Empowered Women Circle, and I'm sure all the women in this conversation who have opted to drop in with us tonight, really powerful leaders in our own circle. So we lead our lives with intent. We lead our families. And I have no doubt that we also lead in other areas of the community, of work, of church settings, of areas where we do co-curricular activities. We, as women, wear so many hats and do so many things that there is no question in my mind that people are looking to you for guidance. No question. And that is the power of having a conversation like this is being able to educate, equip, and empower you to go out and share valuable, high-end, credible, factual information. So what can you do for you? And I bring you back to that opening centering meditation we did, which really, I think, encourages us to really ground into what it is that we are going through in this situation, so that for once, as we sit here, we can think about what it is that I need in all of this. And I encourage you to do a two-step process. Name your feelings first. So I feel scared. I feel, and do this, I've been journaling like never before and meditating like never before. Rose will be very proud of me. My meditation, daily meditation has taken on a life of its own in this, and it's been so helpful. But name your feelings. I am scared. I'm frustrated. I'm terrified. I'm lonely. I'm overwhelmed. You know, these are all my feelings, so I'm sure that you share some of them. And some of your own. But being able to name your feelings is the first step. And as you sit with yourself and you sit with your journal and you name those feelings, I ask you to then turn to yourself and ask, well, what do you need? So as I sit, and I do this all the time, not just during COVID-19, okay, how do I feel? I feel overwhelmed. Well, what do I need? I need to ask for help. I feel scared. I don't know what the future holds. What do you need? I need to have a conversation with my husband. I need to have a conversation with my financial advisor. I need to, I'm scared. What do I need? You can obviously tell I need facts and information. I need to without panicking myself, I need to stay abreast of the information from a credible source. And other than that, stay off the trash news. And quite honestly, I'm trying to stay off social media except for supporting this community. So name your feelings. Connect with those feelings enough that, now hear me on this, enough that as if you were turning to your child or a child or someone who counts on you and asking that person, what is it that you need? Because I have no doubt, I know for a fact that all of you are able to pull compassion and empathy and love for others in your life. And it's time to turn that to yourself like never before. So how do you feel and what do you need? And provide self-compassion around those feelings that you've just named as if you were taking care of a loved one. Because you are worthy of that too. And to ask for support, reach out for the resources as you need them. And I hope I've provided some of those credible resources. And if nothing else, you have a new circle of friends. We are here for you. So let's stick together in all of this. And we are, a number of us on this call, part of a closed exclusive diamond membership. Now the Empowered Women Circle is a big circle. You can get a free account. You can access free resources. For example, this recording, the recording from Thursday. We do Friday sessions, which are educational, which will be focused again on your overall health and wellness, body, mind, and soul. Those recordings are all available as part of our big circle. So ewcircle.com is where, and I should probably show you that, is where you're going to be able to, if you haven't already, you're going to be able to register for, a free account. So ewcircle.com, there's the URL. Sign up for our weekly Women to Women newsletter. And that is our big free community that I pour into with my heart and soul as much as I have to give. Now, some people enjoy more robust and deeper resources, more personal time, more content-driven health and wellness information, and that is what we call our Diamond membership. So if you want any information about that, ewcircle.com/diamonds is where you can go to connect with us. It is only open between sessions because sessions are 3 months long, and we are just ending one session and starting another. So we are in a timely place for us to all be housebound and become diamonds so that we can hang out together over the next 3 months. So overall wellness, mental, emotional, spiritual, physical, relational, and financial, all part of the wellness wheel, which is all part of what we as an Empowered Women Circle talk about. Certain times, certain areas are more ripe for transformation. And so at this point, I'm really feeling that the physical wellness piece has really risen to the top. But we know financial wellness is another one of those big things that's going to become a very acute area of concern that we will have to start working on and digging into so that we stay healthy as a community and as individuals. I've recorded 2 anti-fragility recordings, which the big Empowered Women Circle community has access to. So ewcircle.com, once you become part of that community, mental and emotional anti-fragility, what can we do for our mental health and our emotional health so that we emerge from this actually stronger, more resilient, more robust, more competent, more capable, more resourced than we were when we went into it. And I've already recorded that, and there's so much more to unpack around that. And also anti-fragility in the physical wellness arena. I didn't dig into the immune piece as deeply as I will on Thursday in that recording, but both of those recordings are available to the circle and will hopefully be of value. So we'll come back now. I definitely don't want to keep us any longer than the next 10 minutes. But I will stay on because this is so vitally important. And so let's ask a couple of questions, and then we'll do a little closing right on the hour. We're all in different time zones, but right on the hour, so that everyone that needs to go can go. And I assure you, I will not leave until everyone has had their questions answered. What can I do for you? Medalia, any more questions you've vetted?
There are no more questions in the chat, but if anybody wants to unmute themselves and ask a question, I'd love to hear people's voices.
Yeah, me too. Me too. How about biggest takeaway? I would love to hear a biggest takeaway. You're so welcome, Tammy. You're so welcome, Lori. I see the chats popping up at the bottom. Biggest takeaway from tonight? Somebody have oh, Yolanda, you've arrived. Welcome. I didn't see you come in. Zinc lozenges. Yeah, zinc has been tested on this virus. You're so welcome, Elizabeth. Yeah. Anybody have a takeaway for us?
For me, it's stay home.
Stay home. Stay home. Yes. Yes, yes, yes. Amber, I don't think I saw you earlier. Hello, hello. You're so welcome, Maurice. You're so welcome.
For me, it was the mail and the packages, because I've been getting some stuff from Amazon because I'm not going out with all my issues. Yes, and my husband and I were just talking today. We are definitely canceling my 2-day surgery, which is supposed to be at the end of April, because that would leave him and I both in 2 different places in San Antonio, because that's what the surgery has to be done.
Kim, I think that's smart.
As long as I can walk with my back.
Yep, I know that's smart. I know that's difficult. I was going to say that's a huge sacrifice, but it's absolutely, I believe, the smartest thing for you to do. And we bring our packages. We're still ordering from ID Life and occasionally from Amazon as well, and pizza on Friday night. And we still bring that into the house. The pizza goes right in the oven, but the other cardboard boxes go in a room all their own. And actually, my husband's the only one that's going in to get the stuff out of those, unless I need something, and then I'll go in and I'll make sure I wash down everything.
This one church I belong to, we used to put a cap full, the little cap full of bleach in our, after we had a big dinner to sanitize our plates and stuff like that. I
Yeah.
wonder if you could fix something light like that in a spray bottle when your packages come in, like if they're in the garage, just spray them right away. As long as you don't wipe it off, because that's the thing that they tell you about when you're cleaning with disinfectant. Once you spray your surface, you got to let it sit there for a while, or else you're wiping off what you just put on.
Yeah, yeah, and or you could let them sit, and you could, maybe, use gloves or just not touch your face. Wash
Yeah.
your hands when you.
Yeah.
Yeah, absolutely. Yes, Elizabeth, I wish you all the best with your treatments. It's very challenging times for you to have to make sure you go out, and yes, you have to continue your treatments. We are standing with you and sending you love and support, and anything we can do, reach out, please. Yeah.
Yeah. And I wrote that I was at PT today at Houston Methodist Clear Lake, and my PT person, I've only been there 2.5 weeks, and she already told me, she gave me a bunch of exercises to do. And for the next 4 weeks, they're going to be closed unless it's very essential, or if you just gotten out of back surgery or knee surgery where you have to have somebody working with you.
Yep. Yep. And we have to take this seriously at this time for sure.
And I'm making face masks.
Yeah, and in I'm going to say in Elizabeth's situation, the face mask is a no-brainer. You need to wear a face mask for many, many, many reasons. So that's a different situation completely.
Can
And
I say to Elizabeth that I just received something from my sewing guild, and Deaconess Hospital was asking for masks, so they actually sent us a pattern and said to use 100% cotton fabric, make it 2-ply, put in your pleats. It should be 9 inches by 6, and they're asking us to use 1/8 or 3/8 inch elastic around it. If you can put a tie in there, to do it, to kind of keep it towards your nose. But they're asking for these to be made to be sent to hospitals and that, because that's why the call went out. So, but the elastic's getting really hard to find.
yeah. Yeah, and I would say as well, the sort of the medical doctor in me, Elizabeth, you need the N95 masks, again, for different reasons or for additional reasons, and you need to ask your healthcare provider to provide you hopefully with a couple of those from the hospital if they can possibly get you some. You're not the only one in our community with some potential immune compromise, so I'm speaking to the people with chronic disease or immune compromise. The situation is different for you, and whatever other advice you might need, definitely ask and reach out. I'd love to hear any more takeaways. Any other anything powerful, anything new, anything you wish you heard more of? Tammy, please.
Hi there. Well, a takeaway for me actually was when you had said that you could potentially get this virus again. I was under the impression, and reading the things that I had, seeing, is that once you had the immunities to it, because in the very early stages, you would hear people say, "I'm just going to go get the virus,"
Right.
get around people who had the virus so that I get it, healthy people. And so to hear that you could potentially get this virus again, that was a takeaway for me. I
Yeah.
mean, amongst some of the other things with your supplements and those kinds of things, and the zinc lozenges that were also mentioned. So fantastic session. Thank
Yeah.
you.
Thanks, Tammy. Thank you. Yeah, that was from Jay Butler, Deputy Director of Infectious Diseases at the CDC. And he said, long-term immunity after exposure and infection is virtually unknown. Investigators know that COVID-19 has an antibody response, but whether it's protective or not is unclear. And in regard to older coronaviruses, such as those that cause colds, patients generally would develop an antibody response, may have a period of immunity, but the immunity wanes and reinfection can occur. So they're trying to extrapolate information that they don't really have, but there have been recurrences in China that they've seen already. Less severe, but yeah, it's pretty amazing, interesting. Viruses are such a versatile organism. Any other powerful takeaways? Would love to hear from you guys. Just a couple more minutes here. And I really would like to hear what you found helpful.
The possible projections.
Yeah.
I mean, 98 million possible cases and 4.8 possible hospitalizations and 480,000 deaths. I mean, that really, like, wow, that was like a boom in my punch in the nose.
Yeah, that was presented at a conference in February.
Yes.
To hospitals. Yeah.
Wow.
Yeah. Anybody else?
Hey, Catherine, I had the same takeaway as Tammy. Also, I really appreciate the cdc.gov site that you shared with us. I think that's a great resource as well.
Yeah. Thank you. Thank you for sharing that. Thank you for letting me know. All right, ladies. Jennifer, go ahead. You're leaning forward.
I was just going to say that I just thought it was really good presentation of facts, and it was nice to have confirmation that what I think is correct so far, and to have a little bit more put in there. Like, I didn't know about the zinc. We have such a hard time getting things right now. Like, I went onto Amazon and ordered some zinc lozenges, and they're not going to get here right away, but especially for my husband going out and working, I'm like, yeah. And he already has like he's always had a cough. So I worry about him. Yeah. And I'm not sure if I want to let him back in the house yet, but this is his first day back at work. So I'm like,
Yeah. And for that kind of exposure, I mean, no studies, but we know this zinc may help. And if it's going to sit in the throat and you can eradicate it from the throat, at least in that first 3 days, and you would use it intermittently. I would even use it, 1 lozenge, get them to lay down, every hour or 2 hours, say 3 dosages. We're making this up, but some good exposure of those mucous membranes to that zinc. And that information about zinc originally came, I've seen it multiple times since, but it originally came from a virologist who worked on SARS, who was out of San Diego. And he had some good input from his experiences. Yeah.
At least my husband didn't get SARS when he was in Toronto. So at least that was good. So hopefully he won't get COVID, but.
Now, wouldn't it be interesting to know if the antibodies from one of those other viruses, anyway, that's way beyond my pay grade, my immunology expertise. Well, ladies, it's been an absolute pleasure. Like I said, I'm going to stay on, but I'd like to officially close for tonight. I am so deeply grateful for being in circle with you, because it helps me to feel I can be of service to provide and to share the information. But even more than that, the energy of having women around circle in the evening to share at a time like this, when we're all so acutely stressed and looking after so many people, is just so highly supportive. And I just feel, I feel lifted up. I feel cared for. I feel loved. I feel love around this circle. And I'm really, really, really grateful that you would all spend your evening with me. So I look forward to seeing you all again. I look forward to seeing you maybe on Thursday, maybe on Friday. It's going to be a busy week, but let's come together and do what we can to be in community with each other. Much love, ladies.